mean, gosh, probably one of the first times I became highly aware of metals impacting people's health was a woman for whom I had put in a titanium implant.
Hmm.
Everything went well.
Yeah.
Tissue looked great, but she broke out in hives within a month after her implant placement.
Wow.
And when she came back to get her implant restored 6 months later, I said, "How's your health?" She's like, "Oh, things are pretty good, but I've had this hive issue, and I've been seeing my dermatologist, and they have me on steroids and blah blah blah." And I'm like,
Hmm.
when did that start? And she's like, "Oh, that was about a month after we had that implant." And I said, "Can you wear cheap earrings?" And she's like, "Oh no, my ears blow up," and which is usually a sign of nickel
There's the
allergy.
connection.
Yeah, I'm like, "Oh."
Hello, hello, everyone, and welcome to another episode of Find Your Calm. I am Yunshi Wilson, the CEO, and as you know, we are here to help high performers learn all about how to integrate wellness into their everyday life so they can be more productive. And today I have a very special guest. This is someone I have been looking for for quite some time to talk about this particular topic. It's very unique, and it's a little bit outside of the norm, but it's critically important because we're all about holistic bodily thinking here. We want you to understand how everything is integrated. Um, Today, I have a very special guest, Dr. Kelly Blodgett. He is a general dentist in Portland, in the United States, actually, who is board certified in naturopathic medical dentistry. He's going to tell us exactly what that means in just a moment because he is one of the most unique dentists in the world. So, Dr. Blodgett, thank you so much for joining me today.
Oh my gosh, thank you for inviting me. I'm super excited to talk with you. And gosh, I mean, I just love the idea of find your calm. If ever there were a profession where that is required, it would probably be dentistry, So I'm sure this will be awesome.
Absolutely. You are definitely a high performer. So, in any way that we could serve you, we
Thank
would love
you.
to. So, let's
Thank
jump
you.
right into your background because you have such a unique
Yeah.
background with dentistry, but let's talk about how did you even fall into this field?
Yeah. So I was pursuing psychology in college, and my life's vision was to work with people and help them work through psycho emotional challenges. That's kind of my vision in my late teens, early 20s, and as life path took me down the road at 21 years of age, I became a Christian, and I felt God calling me specifically to become a dentist and to reverse the negative stereotype of dentistry. And at the time, I didn't have any science background, um, and was questioning, like, why on earth would I have, you know, been blessed now that I see blessed with this skill set of understanding how, or at least appreciating, I should say, how people think, how the stories that they tell themselves, the words that we use, things like that. And 30 plus years later, now I appreciate very much the value that education and experience had in getting me to a place now where I'm, throughout the world communicating stories of people's health recovery where their oral health is frequently the missing link or the um, perhaps the maybe not intentionally, maybe unintentionally ignored link to their health challenges. And so, I do a lot of energy rebalancing by removing metals and chronic infections and things like that.
I I can't tell you how because like I don't have a scientific background. I actually have a management consulting background. I just spent the last decade of my life studying all aspects of how does stress impact our body, and that took me down a whole road, as you can imagine. So
Yeah, yeah.
I think this is so important because people do not typically think about dental and health. It's like, okay, if I have a missing tooth, if something hurts, then I'll go. So, talk
Right.
about some of the proactive approach and some of the things that you've seen in your field.
Yeah. So, I would say that like when I was in school, this is going back 30 years, but, in dental school, there's a lot of focus on chronic infection as it relates to gum health, and I would say that the profession, moreover, has been really progressive and, oh, preventative, perhaps you would say, in recognizing the importance of chronic infection as it relates to gum health. However, what I've also observed is, in America alone, dentists and endodontists are doing, more than 20 to 25 million root canals per year.
Whoa.
Each one, oh yeah, each one becomes a chronic harboring area of microbes. And even though, like, I mean, I've tested hundreds of extracted roots to demonstrate the amount of microbial challenge inside every one of these dead roots. And our profession, by and large, is just not only ignoring it. I mean, we're facilitating it.
Right.
And I would say that there are a lot of people who get a root canal, and they're like, "Great, I feel fine. My health is good." And it's not enough to impact them negatively. However, there's a percentage of the population for whom their health never is the same afterwards, or it gets worse sometime afterwards. And unfortunately, that is one aspect of dental health that's just we turn a blind eye to it. When I started helping people remove dead teeth to
Mhm.
improve their whole body health almost 10 years ago, I mean, I have to admit, I was a little suspicious of like, well, I didn't really know for sure how might this impact people, and also how would we support them in their healing. That's a totally different energetic conversation.
Right.
Um, but I think that from a perspective of when a person knows in their gut, I had this done, I have not been the same since, and we as professionals don't acknowledge their truth that they've experienced, we're doing a disservice to those people. So um, we've actually created a practice where, first and foremost, we make space and time to listen. And
Hmm.
that is
Yes.
very unique approach to dentistry. My Mondays, all we do is meet new patients and we do no dentistry. We just listen.
Wow.
Yeah.
That is that is utterly fascinating. I mean, and like sad to say, but revolutionary in that
Yeah.
field, right? Like just listening to the patient so you can understand their history and say, how do we diagnose you moving forward?
Yeah. Well, and also ask questions like, what is it that you want 10 years from now? You've told me what your story and your journey has looked like. If you have the ability to think forward, what is it where would you like to go? What do you want to accomplish?
Right.
And, because when we start understanding both their goals and potentially any mental or emotional roadblocks that
Hmm.
exist in their own ability to see what's possible, it's like I'd rather address that on the front end, and we can develop a strong, mutually working relationship
Yeah.
um, to help them get healthy. And, because you and I both recognize, I'm sure, the body was designed for wellness. And
Yes.
boy, do we get stuff in that, from our cell phones to the garbage on TV to the stuff we consume from the grocery. Like,
Right.
boy, is there a lot of stuff that gets in our way, you know?
Right. Absolutely. So describe for me in layman's terms, for those who are not exactly familiar, what happens during a root canal?
Yeah, great question. Great question. I think most people are familiar with the idea of a filling. You know,
Correct.
like you go in, there's a whole small hole or maybe a large hole in the tooth. It gets drilled out. The dentist fills it, and away you go. Well, inside the tooth, and it would be helpful perhaps to share that when we smile, when you and I smile at each other, we're seeing the top part of the tooth that sticks out of the gums. Well, there's another 60% of that tooth, if not more, that's up in the bone and the gum tissue. And in the
Mm.
center of that root or multiple roots is a canal system that, when the tooth is healthy, is filled with soft tissues such as little tiny arteries and veins, little nerves. Um, So when a root canal is performed, imagine instead of drilling with a normal drill, you're using a very long, skinny file-like drill that
Hmm.
cleans out that canal and it removes, and pardon the phrase, but it's almost like you're lobotomizing the tooth. It's becoming
Mm.
you're disconnecting the internal blood supply and nerve connection to that tooth. So for somebody who has a toothache, that could be a huge blessing, right? Like
Right.
all of a sudden, oh man, this tooth's been killing me. It got decayed or injured or whatever. And
Yeah.
you remove the nerve and suddenly, okay, it doesn't hurt so much anymore.
Right.
Um, the, so that's a root canal. That canal system gets filled in with material called gutta percha. It's mostly some rubbery stuff and some metal oxides.
Mm.
Um, Here's the problem is that our root systems, the entirety of the root of your tooth is made out of a substance called dentin. It's pretty hard, but
Right.
it's also completely porous like a sponge. And I'm talking like each pore is on average 10 to 20 times wider than the microbes that live under your gum line, which have no problem once there's no immune system connection to
Right.
crawling inside the tooth and infiltrating that system. So
Right.
then it becomes this entity that your immune system is aware of, and in optimal health it's going to manage it and it'll be fine for years potentially.
Yes.
For some people it's never right.
Right.
For others, I mean, goodness gracious, my mom just turned 80. She still has one root canal left in her mouth that's been in there over 60 years. You know, go
Man.
figure, right?
Right.
But she's in great health.
That's a
So
blessing.
that helps.
Yeah.
Yeah. But the other five root canals that she had all didn't fare so well and have been taken out and replaced with ceramic implants now. So, you know,
Yeah.
they're not all created equal. And I think that at the end of the day, we as providers owe it to our patients to listen well,
Yes.
listen to what they share about how they feel, what they perceive. Because I've found after being a licensed dentist now for 25 years, um, what people say when they start with, I feel like,
Hmm.
and then I instruct my team to please don't say anything when they're talking and they say, I feel like, listen to what they share and write it down because there's probably some gold in there.
Right. Absolutely. I will. So the next question I have, I will tell you is, I was absolutely blown away when I started seeing this creep up in my research. And I was seeing that people were connecting root canals to breast cancer and then root
Oh yeah.
canals to arthritis. And I was like, wait a minute, what are we talking about here? And then,
Yeah.
of course, once you go down the rabbit hole, you see it so much more. So when I saw that you talk about this on your Toxic Tuesdays, I was like, whoa, finally a doctor that's actually talking about it. So can
Yeah.
we dive down into that and talk about that a little bit more?
Absolutely. Absolutely. Yeah. Um, so here's how it went in my practice. I mean, I was trained in dental school to do root canals. And I will say, I mean, I had a wonderful education. And I believe, or I'd like to believe at least, that I probably helped a lot of people maintain teeth and maintaining your smile and chewing is a great thing for sure. So I want to acknowledge that, not all root canals are the death blow, right?
Yes.
I mean, they can work for some people, absolutely. But after 15 years of extracting teeth where, I was like, what is it that I'm seeing here? Um, I, you know, I would pull roots out. The material that we use to fill them, there's like a very white, opaque sealer,
Hmm.
and the gutta percha stuff looks like kind of salmony pink. Those are the two
Mm.
colors that you're seeing. So I would take these roots out, and I would see a really dense black stripe along the side of that, and I'm thinking, all right, what's this all about? And
Right.
I don't know. I guess I didn't think that deeply for a long time. And it wasn't until a woman called us. This is probably about a decade ago. She called our practice. She asked my front office person who had been in dentistry for over 40 years. She says, I've had these two root canals done. Since I had them performed, my health has not been the same. I don't feel the same. I am positive that these are impacting my health negatively. I've asked many dentists to remove them and they won't do it.
Hmm.
Would Dr. Blodgett remove these? And my front office gal's very savvy, and she's like, well, I know he loves to help people take teeth out well and comfortably and safely, and at the very least, we could get together and have a conversation about it, and he can meet you, and you guys can have a conversation. And ultimately, we did in fact remove those two teeth. What I'll never forget, I don't remember what the teeth looked like or anything like that. That everything went well. What I remember most was her coming back 2 weeks later to remove the stitches. And it was like a different human being had walked into the practice. Like
Whoa.
she had come in originally just low energy. You could feel her sense of despair. And it was, she was suffering. 2 weeks later, here comes this like highly energized woman. She's like, I haven't felt this good in years. It was just like the whole team, we were just shocked. Like, okay. And then it hits you like, okay, so how many people for whom I have performed root canals might be experiencing the same fatigue? And we've never considered whether or not the teeth might be related to this. So for me, that about a decade ago was when my eyes started to open to deeper level of how teeth and our oral health is connected to our whole body health, not just blood supply and lymphatics, but energetics.
Yes.
Um, which it was that stimulus, I guess you might say, that led me down the path of, pursuing a college out in New Jersey that trained us in naturopathic medical dentistry, integrative biological dental medicine,
Yeah.
and I continue learning every day. I mean, God keeps sending me people through whom I can learn more. And it's a really rich, challenging, exciting, fun approach to oral health. And I mean, I would say the last 5 years, I've seen more healing than I would have ever imagined.
Wow.
Um, Particularly by removing the energetic blockage of root canals and metals, whether it be crowns, fillings, implants, tack screws, the things that we put in people's heads.
Yeah.
um, it's been, I mean, golly, I'm thinking of one woman I helped last fall. She had gotten her front tooth knocked out. Understandably, the dentist put in a titanium implant and a bunch of little tacks to help
Mm.
support some
Yeah.
some like bone grafting. And she just chronic migraines ever
Ooh.
since the implant went in.
Yeah.
As soon as we got the metals, we didn't even put in an implant. Like we just took the old implant out, got out the tack screws, and bonded a fake tooth in there.
Yeah.
All immediately, her migraines went away. Haven't been back since. And I stay in touch with her via text. She's doing so well, and she's so grateful, and doesn't even need an implant, and she feels wonderful.
That is utterly fascinating. I mean, it's mind blowing. And it makes me
Yeah.
wonder and just question like, okay, with all the work you're doing, you have the data, you have the proof, you see,
Yeah.
anecdotal impact from the patients. Is there any change that's being done to the traditional educational field of dentistry based upon what you have found in the last decade?
Yeah, that's a good question. I would say, as change is slow. You
Yes.
know, I wish that we would see change happen faster. Um, what I'm observing, I think, still at the level of dental schools, things are pretty rudimentary and it's pretty steeped in traditional approaches, and it's appropriate. I mean, just teaching a person how to look in a mirror and think upside down and backwards,
That's
that's
tough.
that. Yeah, I mean, that's a skill to learn for sure. What I am observing, so right now, currently, I'm doing my toxic tooth tour across like 8 major cities across America. I started in Miami 3 weeks ago, and I'll end in Boston the first weekend of June.
Yeah.
And what I'm so thrilled to see. I mean, I designed this concept to draw in human beings that want to learn about their own health. It wasn't designed for dentists, but I continue to have more dentists show up to these things so that they can learn, be exposed to new ideas. I mean, I just met a woman last weekend in San Diego. She's a retired Army dentist, and she, wanted to learn more about the total connectivity of oral health and whole body health. And I was like, how inspiring, you know?
Yes.
Um, yeah, it's super cool. So I know when I'm going to Chicago here in about a month and a half, there's already like 4 dentists signed up for it.
That's amazing.
So I think there's hope,
Yeah.
you know. I'm an eternal optimist, so maybe I'm looking through the rose-colored glasses. But I do hope, and I do know that it's God's calling on my life to continue lovingly sharing information. It sounds like you've read some of my writing. You'll find I present no dogma.
Yeah.
I just present stories and
Right.
accurate information and published scientific research. That's it.
Yeah.
There's nothing to
Absolutely.
argue with. It's just information, you know?
Right. Absolutely. Absolutely. So, talk to me a little bit because I went down taking a look at one of your Toxic Tuesdays and saw that you connected root canals or to arthritis. And I really thought that was
Yeah.
interesting because I've seen it with cancer and I understood that, but arthritis in many cases can be considered just a chronic condition, an ongoing thing. Talk about how you were able to make that connection.
Right. Yeah. Good question. Um, so if we start with the basics, which is, and you and I were talking about it earlier, the body is designed to be well.
Yes.
And I think there is some positive shifting, I might say, that I'm observing in health, in medicine, and all this, particularly around. You remember how like people always used to say autoimmune, autoimmune,
Yes.
autoimmune, and it's almost like we're blaming people for, well, your immune system doesn't like your body, which just seems
Basically.
weird as all get. It's so weird, and I really do love that the medical community is now shifting that phrasing to immune mediated diseases. I think that's so
Mm.
appropriate because in fact, it's not like it's just out of the blue. We just have, as practitioners, we just have no idea. Like, why are your knees blowing up? Why are your shoulders killing you?
Right.
So, as I mean, our immune systems are designed to recognize foreign things. And
Correct.
let's pick on a root canal.
Yeah.
So imagine, you have a root canal within a month typically, that root system is teeming with microbes. Now imagine every time you chew on it, it bounces up and down. All the microbes that are leaking into your periodontal ligament space that supports the tooth get sucked away by your lymphatic drainage system, which recirculates into your cardiovascular supply. Okay?
Right.
So it's like, and it's a slow trickle,
Yeah.
but just like, a half pack of cigarettes a day after 40 years is a slow trickle, it's going to have an impact. So some people's immune systems, depending on, their genetics, depending on their oral and gut microbiome, depending on their stress levels. I mean, those things that determine how our bodies respond to stresses of different
Yes.
types. Um, for some people, their immune systems are going to their weak link, maybe perhaps that's a better way of saying it, is going to represent itself as joint pain, or some people might be skin lesions.
Yeah.
I mean, it varies from person to person. Um, for some people, it might be, um, gosh, I mean, I've seen so many people who were experiencing chronic tinnitus and vertigo, you know,
Oh,
and again, just other areas where when inflammation starts, and why isn't that the weak link for them? I don't know. I mean,
right.
that's hard to say. It could have been that they were in a car accident as a kid, which negatively impacted, their middle ear. I don't know, right? I mean,
Mhm.
I think as providers, we are wise to be open minded to whatever is possible. But getting back to the root canal concept and its connection, like you're literally being exposed to microbes constantly.
Right.
Um, whether or not that becomes symptomatic, either with the tooth, which I think is perhaps the lesser, and I think
Mhm.
the greater is your chronic fatigue, your um, slowly decreasing bone density, your joint inflammation, your skin lesions. None of those things, for which, by the way, is a person going to go see a dentist.
No.
They're going to see, their rheumatologist. They're going to see their cardiologist. They're going to see whomever is the specialist in that, their dermatologist. and that's fine.
Yeah.
I mean, gosh, probably one of the first times I became highly aware of metals impacting people's health was a woman for whom I had put in a titanium implant.
Hmm.
Everything went well.
Yeah.
Tissue looked great, but she broke out in hives within a month after her implant placement.
Wow.
And when she came back to get her implant restored 6 months later, I said, "How's your health?" She's like, "Oh, things are pretty good, but I've had this hive issue, and I've been seeing my dermatologist, and they have me on steroids and blah blah blah." And I'm like,
Mm.
when did that start? And she's like, "Oh, it was about a month after we had that implant." And I said, "Can you wear cheap earrings?" And she's like, "Oh no, my ears blow up," and which is usually a sign of nickel
There's the
allergy.
connection.
Yeah, and I'm like, "Oh." um, I think that we're going to have to rethink how we're going to deal with this. And we did, in fact, we took the implant out,
Yeah.
and she ended up having a bridge instead, and that was fine.
Wow.
But it's amazing what we don't know in the journey. I keep praying, like, what else do I need to learn so that I can better serve people?
Yeah. I mean, truly, Dr. Blodgett, I mean, your work is utterly fascinating. The only doctors I've ever truly come across that look at the body truly holistically are functional medicine doctors. Because
Yeah,
naturally, I have friends who are doctors. They were like, we don't go to school to learn how everything works. You have a symptom in your heart, I deal with
right.
your heart, you go away. And every doctor is
Yeah,
taught that same way. And so it was a light bulb for me when I realized this years ago. And I was like, well, if I'm dealing with chronic stress that impacts my entire body and you are only telling me one thing, then there's going to be a disconnect here.
totally. Oh my gosh, absolutely. And I think it's fair. Gosh, when I think of the folks who were taking the training that I did out in New Jersey, all of us had been in the profession for 15 plus years,
Wow.
and I think that's fair.
Yeah.
It takes enough time to appreciate the intricacies and the subtleties of, when you do something as small as place one filling in a person's tooth,
Hmm.
or let's say you put
Yeah.
one crown on a person's tooth. And I'm thinking of this because just yesterday we had a team meeting, and we invited the woman who runs the biocomp lab in Colorado to explain to us the science behind um, these tests where we're looking at what materials are. It's like a biocompatibility testing system for
Mhm.
dental materials. And she was explaining to us, like, we test for these 80 some odd metals, or not metals, but elements. And
Mhm.
if your body's immune system tells us it's highly sensitive to any of these things, then products A, B, C, and D aren't going to work for your body, right? So knowing that prior to restoring somebody's dental health would make a ton of sense. It's a
Yeah.
lot safer than guessing, right?
Right. Right.
Yeah,
Truly prescriptive medicine. I mean,
right.
it's revolutionary and it feels like that's where medicine needs to go. And
Yeah,
there was a study that just came out recently from the McKinsey Health Institute talking about the gap for women. And I was shocked to learn that up until like 2016, many in the NIH and the EU was basically using lab rats that were men, the male species only, because the female was too difficult
oh
there were
no,
too many variables. And I was like, wait,
right.
you got to be kidding me. And this was the norm though. So everything you're
Yeah,
talking about is that prescriptive approach that we've got
yeah,
to get to so that people aren't dealing with the impacts of things later
right.
on. That's like, well, where did this come from?
Yeah, well, I think that one of the things as we look at um, holistic, integrative, functional, whatever you want to call it, an approach to health where we're concerned and considering all aspects, there are a lot of things that can be modified in an instant. You can change your diet.
Yes.
You can change your environment. I mean, to a better extent, right?
Yeah.
What's so unique about dentistry and some other branches of medicine, but particularly dentistry, is those things that we are doing. Let's say it's a dental implant, it's a crown, it's a filling. I mean, our hope is that that will not be changed out for hopefully decades, you
Right.
know?
Right.
I mean, so there's never a time at which you're not exposed to it.
Hmm.
So if you put in, and I helped a woman last year where, I mean, great gal, she had seen a wonderful dentist. He's a thoughtful guy. He had put in two crowns and they fit beautifully. The bite was great. Everything about them was wonderful, except for the fact that she's highly allergic to lithium and they are a lithium disilicate ceramic. And
Wow.
the way that she described it is she's like, I don't know how to say it. I just know my body is aware they don't feel right.
Mm.
And by changing those out and using a different type of ceramic, her body was able to go, oh, okay, like that actually feels normal. Okay,
Wow.
great. Wouldn't that be helpful though to know that before you embark in restorative dental care?
Absolutely. Absolutely. Uh, I I truly believe what you're doing is revolutionary. I cannot wait for our audience here to see this and to
Yeah.
really dive into it. And I'm really hoping that, within Dubai, but even beyond, people come to you or say, "Can you come here? Teach us this."
Yeah, we actually had last year our first patient who from Dubai. He flew out to Portland, Oregon. He'll be flying out this year to get his implant teeth placed after he's healed. Uh, but boy, I've never been to Dubai, and I would love to visit and connect with people. Yeah, for sure.
Absolutely, absolutely. I mean, I definitely I can't thank you enough for the time that you spent here, getting up so early for me to share all of this amazing information.
Oh, Yuche, it's my pleasure. It's so nice talking with you.
Thank you. Thank you. I always close out the podcast by asking my guests one particular question. So I'll toss it your way. And that is, as a high performer yourself, how do
Yeah.
you find your calm when you're dealing with high stressful situations?
Yes. So part of my, if you want to call it daily therapy, is playing music. So I've been a musician for 45 years. I play guitar, bass, drums, piano, sing, and usually my decompression after my day at the office is to spend 10, 15 minutes noodling on the guitar. Um, and the other thing I would share that's more of a recent practice. Um, we invested in our practice I'm sure you're familiar with a PEMF machine,
Hmm.
pulsed electromagnetic fields machine.
Hmm.
And I have thoroughly been enjoying using that just as kind of at a cellular level, a reset using our PEMF machine. And we also have a Novathor red and infrared light therapy bed in our practice.
Love those.
And yeah, I find that intentional influence of electromagnetic fields and photonic energy is just such a wonderful thing to my human experience and for all of our patients.
Yes.
Um, so that I love that stuff. I do it as frequently as I can. It's awesome stuff.
Oh, we got to get you back on to talk about some of the fun tools.
Oh, so just to share, like the first 15 years before I became highly aware of the connectivity of all this integrative health stuff, my focus was mostly on dental technologies, particularly lasers and biophotonics. So for
Mm.
20 some years, like that's been my area of specialty is how to use light in a dental setting for both surgical applications and biostimulation.
Oh, now that's revolutionary. I've heard it for skin, headaches, just healing even when you're sick to kind of shorten that time. But this is some next level stuff.
Yeah, imagine how calm patients can be when they're not having their head vibrated, you know?
Right.
It's it's such a different experience, many of the technologies that we use that do in fact change the experience physically and therefore emotionally.
Wow.
When people aren't like we're redefining what it feels like to be at a dental office, which is
Yeah.
really fun.
Oh my gosh. This was great. I cannot wait for
Thank
this
you.
episode to go live. Thank you so much.
Absolutely. Thank you, Jay.
All right. Well, Thank you guys for watching. This has been another episode of Find Your Calm. We'll leave all of Dr. Blodgett's links in the links below, as so you can find his website, follow him on social, so you can check out Toxic Tuesdays as well as Wellness Wednesdays. Is that right?
That's right. Thank you.
Thanks again, and have a great day.